Let's now move on and talk about COVID-19. A new symptom is being talked about in India. Pink eye, also known as conjunctivitis. What is the link of this to COVID-19? It is being noticed among children and infants. Amid the recent spike in the COVID-19 cases, children aged below 1 year are at the highest risk as per reports. And this rise is driven by the subvariant of Omicron, XBB 1.16. And as per reports, conjunctivitis is the main symptom among children. What is conjunctivitis? It is a type of swelling that happens in the eyes and can be accompanied by pain and redness. A lot of times, it can lead to irritation and teary discharge. It is contagious in nature, which means it can spread from one person to another. Further, in some cases, it can also lead to light sensitivity, which is accompanied by puffy eyes. In fact, recent studies have confirmed that young infants are infected more than older children. What are the doctors saying? They advise vigilance towards pink eye as it is observed to be a defining factor in diagnosing COVID-19. While among adults, the symptoms include muscle pain, a loss of appetite, fatigue, also noted to be common. The good part is that these can be managed symptomatically and go away with treatment for children in particular. Healthcare providers have advised the parents to wash their children's eyes with warm water. It is believed that this works both as a remedy, also as a preventive measure, to stop the virus from spreading further. And in teenagers, the major COVID-19 symptoms including body ache, weakness, fever, sore throat. While most of these symptoms are manageable and mimic flu, the total duration of these symptoms ranging from 1 to 3 days, expected to be mild in nature. Vigilant testing, being alert towards flu-like symptoms goes a long way in diagnosing and helping in stopping the spread of COVID-19. And apart from conjunctivitis, respiratory symptoms are also being observed. While adults and children both are impacted, these symptoms are predominantly being seen among infants. So just to put it simply, do not let your guard down. Face masks continue to be integral weapons in the fight against the virus. Wash your hands at regular intervals. Though COVID-19 cases are on the rise in India, effective measures are in place to contain the spread. More than 189,000 samples were tested in the last 24 hours alone, with roughly 63,000 active cases. India has been leaving no stone unturned in its fight against the Wuhan virus. So if your child complains of a red eye, or your teenager complains of body ache, or you experience body ache, do not ignore these symptoms or dismiss them as just being a case of feeling under the weather. Get yourself and those close to you tested. WION now available in your country. Download the app now. Get all the updates on the move.